Rebecca Akufo-Addo, the First Lady of the Republic of Ghana, has always been a passionate advocate for the well-being of Ghanaian women and children. She co-founded the Infanta Malaria Foundation in 2005 with the focus of reducing the incidence of malaria and malnutrition in children and pregnant women. In early 2017, she set up the Rebecca Foundation to deliver socio-economic interventions that impact positively on the lives of women and children, especially those in deprived communities.
For me, being First Lady gives me the opportunity to make a difference in the lives of women and children. And so my team and I are focused on health, education, and empowerment of women and children.
Since 2005, Her Excellency Mrs. Rebecca Akufo-Addo has pursued her dream that all children and mothers would stay healthy and live to achieve their full potential. This is what inspired the starting of the Infanta Malaria Prevention Foundation. Infanta has supported health outreaches to several communities across the country. These outreaches are for preventive health education, including insecticide-treated bed nets distribution and follow-up to the household level, and also treatment for ill health, particularly malaria.
The Rebecca Foundation works with outreach doctors to bring health services to deprived communities and vulnerable groups.
We have a team of 20 medical staffs, which comprises of medical doctors, dentists, ophthalmologists, lab technicians, nurses, and then auxiliary health staff. When we move to these communities, what we normally do is to screen them on hypertension, diabetes, hepatitis, malaria, and then what we do is we do eye screening, and then also we do dental examinations for these people. When we go out to do these screenings, we pick out some vital cases where we are not able to manage at the screening centers. What we do is that the Rebecca Foundation, we talk to the foundation, and then they help us out to alleviate some of these problems these people are facing.
The Korle Bu Teaching Hospital was built decades ago when Ghana's population was much lower. Today, the population has grown and most facilities are stretched. The hospital is a heavily used tertiary referral center. The high congestion at the children's emergency ward is a contributing factor to mortality, which is unacceptably high. 3 to 4 children die within 24 to 48 hours of admission.
I'm in the old part of the children's emergency room, and cursory look just tells you that this is a very dilapidated building. We actually moved out of this place 5 years into a more or less refurbished part underneath the old OPD outside. And we've been there for the last 5 years with the hope that we will get a modern emergency complex.
Some of them, we even nurse them. You see these chairs here, we attend to our patients on this chair whilst the mothers are holding on to them. It's very difficult for us to work under this situation. You see how the room too is, even fans in the room, they are not working. So it's very hot and not conducive for working environment.
At the moment, the Rebecca Foundation is raising funds to help build a hostel for parents with children who have cancer. And also, the Children's Emergency Ward at Korle Bu is in a deplorable state. We're raising funds for that as well. The third thing is to also raise funds for a cancer treatment center.
We are pleased that the Rebecca Foundation has finally arrived in the children's department that would really reduce the mortality in the children of Ghana.
Korle Bu Teaching Hospital is one of 2 referral centers for child cancer treatment in Ghana and sees many sick children. Unfortunately, in Ghana, the cure rate for childhood cancer is as low as 30%, unlike 80% in other countries, because most patients abandon treatment. One of the major reasons is the lack of accommodation facilities for families of children on treatment.
Children require treatment that lasts sometimes from a few months to a couple of years, and they would need somewhere to stay for the duration of the treatment. Fortunately, the Rebecca Foundation has come to our aid. Since the beginning of April, when construction started in earnest, we've been able to raise the structure up to the first floor level. And we hope that with the assistance of the Rebecca Foundation, we'll be able to complete this structure within the next few months.
The Rebecca Foundation has hope. Hope that providing a solution will help save the lives of children and bring comfort to parents.
In Ghana, women are known as the real change makers, and yet they don't earn as much as men. And so the Rebecca Foundation is empowering women to improve their economic status so they can take better care of their families.
When the social and economic status of a woman improves, families and society benefit. Telema is an economic empowerment program by the Rebecca Foundation to support women to improve their economic status. The Rebecca Foundation, together with partners, provides skill training, access to low-interest financing, and improved market opportunities for women.
2 years ago we started, and along the line we met Mrs. Rebecca Kufuor. She wasn't the first lady by then, but she gave us all the help that we needed.
The Rebecca Foundation has really helped us to achieve this aim. We really want to do more. They are being trained, they love what they do, they just need us to give them the support financially and then guide them to also go far and then help others as well.
Metumi aye me die eno eboa me metumi edi hwefie metumi edi ma me nuanom edi kwachimi obi a oni bi kra timi ba na se me ya me de ma no edi ko echi eno menya eno eso mfaso no edi hwe me ma edi hwe omu school nti me se me da ya mame ase eni edwuma pa.
The Rebecca Foundation is working with partners such as TechnoServe and other governmental and civil society organizations to train about 200,000 women across Ghana in various fields.
In Ghana, girls are more likely than boys to drop out of school due to poverty and other factors. The Rebecca Foundation is working in poverty-endemic communities along the coast of Ghana, where attrition rates for girls are high and enrollment rates for girls are low to keep girls in school. The foundation believes that for women to be empowered, they have to be educated. Hence, the start of the Girl Child Education Program known as Because I Want to Be.
Because I Want to Be is an initiative for girls' education. We all know how important girls' education is. We want girls to go to school and remain in school. And the message we're putting out there is that girls can be whatever they want to be.
We as UNFPA, we partner Rebecca Foundation to enable the foundation to achieve its goals. We provide technical support. What we want to do basically is to try to get the girls that are out of school to come back into school. We want to try as much as possible to get the girls that are in school but are likely to be out of it for one reason or the other, either as a result of early pregnancy or what have you, to be able to get them to ensure that they stay in school.
I'm in school today because I want to be a cosmetologist in future. And before I achieve this goal, I need to be educated to the highest level.
The link between literacy and improved livelihood outcomes is clear. We need a better literate society capable of being trained to the highest levels of competencies for Ghana's development.
Having a library in this school will help me and my friends as well to achieve our goals and help a lot to the development of this country.
The Rebecca Foundation feels it ought to do more about literacy. And so we're partnering some groups to help us build libraries in our schools and in our communities.
These libraries will be located in school clusters where you would have a group of schools who would have a total population of about 3,000 to 5,000 children, and these children will then have access to these libraries to improve their literacy skills and their learning abilities.
Developing sustainable communities is one of the objectives of the Rebecca Foundation. Let's Go Green is a project which involves the establishment of new landscapes and ecological features across the city of Accra. This project will help preserve Ghana's rich horticultural heritage and ensure healthier and more beautiful communities. The Rebecca Foundation engages in partnerships and resource mobilization for funding. The foundation fundraises and accepts grants and donations.
Under the Rebecca Special Initiative, we work with communities to identify basic needs that have the capacity or propensity to change or improve the lives, especially of women and children. The construction of the new Komfo Anokye Mother and Baby Unit is one such community-led initiative under the Rebecca Special Initiative.
All along we've been having problems and challenges with bed space and also space in the theater, especially when we have to deal with emergencies. Emergencies concerning deliveries. We have only one functioning emergency theater. So when the person comes and there's an operation ongoing, what it means is that they have to be in a queue. There are times you have to pick and choose which one to do first and which to do next.
Sometime in March 2017, we produced a documentary called Next to Die. The documentary showcased about the condition at the Mother and Baby Unit in Komfo Anokye Teaching Hospital, Kumasi. The situation was really bad, where a high number of deaths was recorded in terms of mothers and also babies.
The mortality rate under the old Mother and Baby Unit was unacceptably high, recording 3 to 4 deaths each day. Women are referred here, needing urgent operative intervention, but the hospital was limited in the scope of what they could do because the old structure had only one functioning emergency theater. In early May 2017, the Rebecca Foundation started a fundraising drive to build a new Mother and Baby Unit in the Komfo Anokye Teaching Hospital. The Rebecca Foundation, with the support of corporate and individual donors, completed a state-of-the-art Mother and Baby Unit made up of maternal, neonatal intensive care, and pediatric intensive care units. The facility has provided the hospital with the much-needed space and modern equipment to help reduce the unacceptably high maternal and infant mortality rates at the Komfo Anokye Teaching Hospital.
I must say that we are very grateful to have the First Lady assisting us with the construction of the new Mother-Baby units.
All the initiatives under the Infanta Malaria Prevention Foundation and the Rebecca Foundation are geared towards achieving the Sustainable Development Goals.
My mission is to help provide a better life for women and children, but I cannot do this alone. The Rebecca Foundation needs the help of everyone.